Let me bring in Dr. Nihar Parikh, pediatrician and director at Just Childcare for more on this. Dr. Parikh, hand, foot, mouth is perhaps one of those diseases that every parent fears more than the children themselves. It comes back every year. There seems to be no one reason for it, and it keeps coming back. There is no immunity building on this one. So at the onset, I want to understand from you, till date, do you think there is enough information, awareness on hand, foot, mouth, or are people still sort of confusing it with, say, chicken pox, measles, smallpox, because it kind of looks similar?
Hi. So basically, hand, foot, and mouth has been around. We've seen a lot of cases over the last 8-10 years. It's a yearly occurrence. It's an occurrence where, since the disease, it's a viral disease, it's highly contagious. It spreads on touch and saliva and fomites, something a child is touched and another child touches. And usually there are outbreaks as soon as school reopens after the vacations, which now coincides with with the rainy season. So as the viruses thrive in rainy season, the schools reopen in the rainy season, and this virus basically is sort of in between a chicken pox and in between a normal viral, where the child gets a fever for a day or may not get, but the boils which are there, as the name of the disease suggests, starts on the hand, the feet, and inside the mouth. Now, they're just a quick progression of the disease. The boils start on the second to third day, peak on the fourth and the fifth day, and by sixth or seventh day, they disappear. Usually occurs in children anytime after the 9 months of age, can go up to 7 years of age. But we've seen older kids also get it again and again. We've also seen, but it's much milder. Few adults get it, but it's extremely contagious in children from 9 months of age to 7 years of age. And the only thing that bothers every parent is that trauma of the boils inside the mouth, which makes the child not eat for a few days and suffer through a lot of pain, drooling because they can't swallow saliva, they don't eat. But it's a self-limiting disease. It's not, it doesn't cause complications, so we don't need immunization. And because this virus has multiple forms of it, one immunity, getting the virus once doesn't mean they won't get it again. We've seen it occur as frequently as every 2 to 3 months as well. But the ones after the first one are usually the milder ones. But yearly phenomena, very common.
Very common. Dr. Parikh, I want to understand, at what stage is the virus most contagious? Because a lot of people think of it as a regular flu. From what I understand, the first 2 to 3 days, when you have the fever and a very mild fever that goes unnoticed, sometimes that's when the virus is really spreading. And there is no way of telling if this is actually hand, foot, mouth till the time you see the boils sort of appear.
So that's the unfortunate bit, because till they usually get contagious sometimes on the day of the fever, even a day before the fever, before these boils actually come up. So if the boils don't come up, the parents are left clueless whether they're contagious or no. And even if the boils happen to come up in the mouth first, it's impossible for the parent to realize, because the only thing that would happen was the child would stop eating. So it's a very standard dictum to all parents that if there is fever, or even in today's day and age, even if there's a gut feeling, what we call as a parent's intuition, that the child is coming down with something, I usually request all the parents, to be a good Samaritan, not to send their children to school, because eventually they'll end up getting something which is contagious. And something like hand, foot, and mouth, once a child reaches a school with this disease, it spreads like forest fire, and usually land up infecting 70 to 80% of the kids in that grade.
Right. So, Dr. Parikh, what is your advice? I know in schools, they are taking a lot of precautions. I was dropping my kid in the morning to her toddler school, and the teachers were all there at the stations checking for symptoms and all of it. In my head, I was thinking, if you have to check for symptoms, that means it's already spread. So there's a problem there. There's no way of detecting it beforehand. And then there are the other kind of parents who say that, listen, this is spreading. I will not send my kid to school. Let's keep them at home. So what's your advice? Can you sort out a mother's dilemma there? What to do at this time of an outbreak?
So my answer to that question is picking the middle path. The parents and the school have to work hand in glove. It's a very simple thing. Today, the schools do have an option of online. So if there's even one case detected in a particular class, I would request the class to be online for a few days. And all the parents in the class should keep the other parents and the teachers notified if their children have got the disease or no. Number
Yeah.
one. Number two, I also want to tell every parent that there is no reason to panic because this disease, although extremely contagious, has no long term sequelae except your child going through some pain and remaining isolated for 5 to 7 days. So please don't panic and don't kind of play the blame game in which you're trying to figure out who gave your child the disease and this school should take
Very
more care.
important.
Because because in this day and age, I think every parent wishes the best for their child and children around their children. So I think we all should come together as a team, including the school, considering the option
Yeah.
of online schooling.
Yeah,
There is
but
a
Dr.
particular
Parekh, very
small
quickly help
outbreak.
me understand this. In a day and age when we have a vaccine for pretty much everything from weight loss to weight gain to why isn't there a vaccine or an immunization program against hand, foot, mouth? How difficult is that?
It's not difficult, but to invest millions of dollars for a disease which is not causing death or hospital admissions is not advisable. Building natural immunity over time, all it kind of demands is a few days of the children suffering through a particular disease. But since this disease has a 0% chance of any long-term sequelae, any complications, or any reason to get admitted besides a little dehydration, sometimes the child is not eating anything. Making a vaccine out of this would not be, let's say, in a business-oriented term, cost-effective.
Until you get the mothers to become scientists and they find a cure, which is much better than much better than a vaccine. We leave it there for the moment. Thank you
I
so
would
much,
agree.
Dr. Parekh, for coming in and sharing all those details.